Ladies and gentlemen, welcome back to another video on the YouTube channel. Today, as promised, we will be explaining part 2 of the anatomy of the skull, which will be the basic cranium, the external surface of the basic cranium, the internal surface of the basic cranium, and then last but not least, the foramen, holes and pores inside the skull. And yes, there are holes inside your skull. So, started off simple and easy. We'll begin with the external surface of the basic cranium. Logically, if you want to see the external surface, you will look at it from the bottom, like a mechanic going under a car. So, beginning from, I will just describe all the bones that are composing the basic cranium again as a quick revision for those of you who did not see part 1. We have the maxillary bone, we will have the palatine bone, the vomer, sphenoid, occipital and temporal bones. All those form the basic cranium. Okay, now starting anterior to posterior from the external surface of the basic cranium, I will begin with the maxilla. Logically, that's the anterior most part, and specifically we have the alveolar arch. So there's only one arch present here, which you can pretty much see, and that is the alveolar arch. We're getting a bit kinky with all the arch talk. Alveolar arch contains all the alveolar processes, which are your teeth, and yeah, that's about it for the alveolar arch. I don't think I can talk more about that. Then moving backwards from the alveolar arch, we will have the palatine processes of the maxillary bone. Palatine process of the maxillary bone, which forms the anterior most part of the hard palate, and then that's the anterior part of the hard palate. And the posterior part of the hard palate, we have the horizontal plates of the palatine bone. So draw it like this. We have the hard palate split into two parts to the midline, anterior, posterior. Anterior part is formed by the palatine process of maxillary bone, and the posterior part is produced by or created by the horizontal plates of the palatine bone. Right here, this is palatine bone, these are the horizontal plates, this is the maxillary bone, and that's the hard palate part with the palatine process. Now, one more tiny little thing that I want you guys to know about the anterior most part of this, which is the maxilla and the hard palate. We have little foramina here, right here. One second. Yeah, right here. It is, to be anatomically specific, it is posterior to the central incisor teeth, or the incisive fossa. This is the incisive fossa. So the central incisor teeth, which people usually have them as bunny teeth, those two teeth at the very front, posterior to those we have the incisive fossa, and then posterolaterally on the bilateral sides we have the palatine foramina. Now, to help you guys wrap your head around the anatomical lingo, we will go postero, lateral, so right here, this one right here, and bilaterally, so on both sides. Posterolateral and bilaterally, so right here and right here, we will have the palatine foramina. Greater and lesser, it is split into greater and lesser. If you can make it out, if you can try to see it, it's a bit hard to see here because they're not labeled, but these are the greater and lesser palatine foramina. Now, one last thing about the hard palate, we have the posterior edge of the palate. So right here, the posterior edge. Posterior is the back, edge is an edge. Don't think I have to describe edge. Posterior edge of the hard palate forms the inferior boundary for the nasal conchae. So if you remember the nasal conchae from part 1, the posterior edge of the hard palate forms the inferior boundary, so the bottom, basically. It's like the floor for the nasal concha. Then moving backwards, we will have the vomer, and then let's say the big boss of the basic cranium, the sphenoid bone. Now, I am assuming, considering we're all medical students, have a very big problem with the sphenoid bone because it is a very weirdly shaped bone, and if you look at it from two different angles, you can think it's two completely different bones, but it is just one bone with a very unique structure, and it's a bit difficult for people to wrap their heads around, and I will try to make it as simple as possible for you guys to understand. This is the sphenoid bone present in the skull, in the basic cranium. If you guys want a separate video just on the sphenoid bone, just to describe its parts, its shape, I will gladly do that. Just let me know in the comments, but to save us some time, I will just explain it as it is in the skull. So this is the sphenoid bone. It is. I'm going to talk about its anatomical location, and when we go to the internal surface, I'll break it down completely. Anatomically, it is placed between the anterior bone, frontal bone. Sorry, what's the, frontal bone anteriorly, the temporal bone on both sides, and the occipital bone posteriorly. So it is situated between three bones: temporal, frontal, and occipital, each on its respective side, as you can clearly see here. And the sphenoid bone itself is composed of different parts: the greater wing, the lesser wing, the pterygoid process, which is split into medial and lateral plates, and the body. So just gonna label them for you guys. They're already colored here, but for you guys to see them more obviously, this is the greater wing. Logically, because it is larger, it would be the greater wing. This is the lesser wing, the yellow one right here. That's the lesser wing. Also under here you have the Latin name, if any of you are interested. Here we will have the body of it, and to find the pterygoid processes and the plates, we will need to rotate back into this view. Right at the bottom, see here, it all just fits together. It's like a big puzzle, and you need to make it work. Right here, see this? Boom. Medial pterygoid plate, and one second, lateral pterygoid plate. Get it? Medial pterygoid plate because it is more medial, more to the center of your body, and this is the lateral pterygoid plate. And again, from the bottom you can also see the greater wing of the sphenoid bone. The lesser wing you can only see from the inside because it is too little, too small to help on the outside. Get it? It's easy once you wrap your head around it. I will, if you guys want another video just explaining the sphenoid bone in itself so you guys can remember it better, I would gladly do that, no problem. Alright, so now moving on to the internal surface. The juice of this, the gist of the whole basic cranium is the internal surface. Internal surface of the cranial base is split into three major parts: the anterior part, the middle part, and the posterior part. Right? Keep it simple, just three parts, no need to complicate it. Divide it into three. Logically, this would be the anterior, this is the middle, and this is the posterior. So, for the anterior part of the internal surface of the cranial base, we will begin with, it is composed of three bones. Anterior, frontal bone. Why do I keep calling it anterior bone? Frontal bone, ethmoid bone, and the contributions from the sphenoid bone, which include the body and the lesser wings, because we said they are only on the internal surface, so they will logically be anterior. Okay, the frontal bone. Now, what I want you guys to know from the frontal bone, there are a lot of, let's say, indentations and different regions of the frontal bone that might be important for sinuses and all. I will get to those when I explain the sinuses. For now, I just want you guys to know the bony landmarks, the important bony landmarks, which would be here. It's not labeled. The frontal crest, right here. I want to try to show you guys in 3D what it looks like. See, right there. This one right here. This little crest here. This is the frontal crest. The thing about the frontal crest is that it contains a very important, well, not let's say important, but a very distinctive hole known as the foramen cecum. Now, if you guys need help remembering that it's foramen cecum, you see with your eyes, and the foramen cecum is the anterior most foramen close to your eyes, and it's in your head. I don't know, third eye maybe, if you want to go into it, like, because you know it's in your forehead, third eye type of thing. Get creative with it. Foramen cecum contains the fetal development vessels, which are the vessels that are required for fetal development of the brain, of the body. They pass through here. Usually, there are no vessels in most people. However, in 1% of the population, we have the nasal emissary vein. Yeah, that is all I want to talk about for the frontal bone. Other than that, it creates the roof for the orbits right here. See? These are the orbits. Your eyes sit in this place, and the frontal bone creates its roof. But that is away from the basic cranium, so we just want to focus on the foramen cecum for now. Now, Moving on to the little bone that a lot of people forget about, the ethmoid bone. It is a very important bone, but it is very much easy to miss because it's not that distinctive, let's say. So I will try my best to make it distinctive for you guys. Moving down from the foramen cecum, from the frontal crest of the frontal bone, continuously you will go into this, the ethmoid bone. But specifically, what part of the ethmoid bone? If you guys remember, in the first part we talked about the crista galli. This is the crista galli. It is a 3D, let's say, elongation from the ethmoid bone that goes up superior, and it is continuous with the frontal crest. Now, in most books, you will see the crista galli as a 2D line. It is not that. Please, guys, I want you guys to remember and to be able to differentiate that it is not a 2D line just present on top of the ethmoid bone. It is a 3D projection continuous with the frontal crest. This is the crista galli right here. And we said in some people, let me just locate it for you guys. In some people, we said it is prominent from the front. So if you want to look, see right there, see it is right where we said it was in the last video. See, it is right here. Go straight through, you'll find it on this side. It depends on some people. Some people it is very dominant, prominent. Some people it's not. Now, if you guys have wrapped your head around the shape of the crista galli, where it's present and all that, on both sides of it, left and right, we will have the cribriform plates, or the ethmoid plates. They are sieve-like plates on both sides of the crista galli. They're not located here. This is the right one, this is the left one. They are sieve-like plates, and they contain axons for nerves, which again, it's a part of the cranial nerves we'll get into when the time is right. But right now, I just want you guys to know the anatomy of it. So, crista galli, cribriform plates, also known as ethmoid plates, and that's it. No more, no less. Okay. Now, moving on, I just want to summarize the foramina that are present inside the anterior part, or the anterior part of the cranial nerve. We have the foramen cecum. We have the anterior. Oh, and I forgot to mention the anterior and posterior ethmoidal foramen. Sorry, what is it? It's lagged. Okay, the anterior and posterior foramen, ethmoidal foramen, which are present right here. 1 second, please. Sorry. Yeah, anterior and posterior ethmoidal foramen, which they are not shown here, but in most of your anatomy books they will be very present and very easy to distinguish if you look at the image. I'll edit an image right next to it right here. You should be able to see it over here. We have the anteriorly obviously, and posterior ethmoidal foramens. They'll be here. They're bilateral on both sides. So one here, that's the anterior, one here, and one here, that's the posterior. There'll be an image here so you guys can be able to tell the difference or know it. And we also have the cribriform foramina and the plate. These are considered foramina. These right here, these holes, they're considered foramina. Sorry, these are considered foramina. And like I said, they are for the cranial nerve, the olfactory nerve, specifically for the axons. Now, moving backwards. I do not mean like in the bad way. I mean like literally, physically, anatomically, posteriorly, working away posteriorly, we have the middle cranial fossa. Now, the middle cranial fossa is formed of the sella turcica. That is the most, let's say, how we have the sphenoid being the most prominent of the whole basicranium. The sella turcica is the most prominent of the most prominent. It comes from the word of Turkish saddle, because it actually looks like a Turkish saddle, and I will show you the image here of a Turkish saddle. Okay. It is composed of 3 parts. Okay. Tuberculum sulae, if you want to translate that, it is horn of the saddle. Hypophyseal fossa, which is the pituitary fossa, and the dorsum sellae, which is the back of the saddle. Okay, so this is the sella turcica. The horn of the saddle would be anterior, and the this is the posterior clinoid, this is the dorsum sellae, which is the back of the saddle. Makes sense? Logical? Clear? Something that I want you guys to know is that we have the anterior, what bounds it is the anterior and posterior clinoid process. That's what bounds the Turkish saddle. We have the anterior clinoid process, which is right here. For you guys to remember where the anterior clinoid process is, or where it comes from, it is the sphenoidal crest. Now, as we described the frontal crest, we said it's a line. Just find the line that walks between the greater wing, the lesser wing, and it will end in the anterior clinoid process. So this line right here, starting here, walking down, making our way more medial, boom, anterior clinoid process on both sides. See, anterior clinoid process as well. Then we will have the horn of the saddle, the sella turcica, which is the sella turcica is the whole thing. Horn of the saddle will be here. We have the posterior clinoid process right here, and the dorsum sellae, back of the saddle, right here. So I will show you guys an image of the saddle and an image of these three parts just alone, so you can kind of see it. Sorry, one second. So you can kind of make it, it kind of looks like a saddle if you look at it right now. Yeah, kind of looks like this. Posterior clinoid saddle, we will have the horn of the saddle and the dorsum sellae right here. Now, moving on to the other parts of the sphenoid, which basically is the greater wings of the sphenoid. Greater wings of the sphenoid here bind with the squamous, or the flat part, and the petrous part of the temporal bone. This is the right temporal bone. We will have the squamous part and the, one second, rocky part, petrous part. If I can just get it to focus.